Imagine burning your arm on a hot oven and feeling absolutely nothing, not ignoring it. Your brain simply doesn't register pain. Now imagine you also feel no fear, no anxiety, not even stress. Sounds like a superpower? It's real. And her name is Jo Cameron. This is her story. Jo Cameron lived a quiet life in Whitebridge, Scotland. She cooked, walked, and interacted with others like anyone else. But there was something that made her truly unique, something she didn't even realize until she was 65 years old. She couldn't feel pain. It all started when she underwent hand surgery. Doctors warned her about the painful recovery, but Jo didn't ask for painkillers. She didn't need them. She felt nothing. No burning, no stinging, no discomfort. Just a mild sensation she described as gentle pressure. Doctors were stunned. How could someone feel no pain after such a delicate procedure? They decided to investigate further. What they discovered would change how we understand human pain. Jo had a genetic mutation in the FAAH-OUT gene, a region of DNA previously considered junk DNA, thought to have no function. But in her case, this mutation blocked the production of enzymes linked to pain perception, anxiety, and fear. Her body also showed accelerated healing, and her emotional state was remarkably stable. She didn't suffer from stress, anxiety, or fear in situations that would normally trigger panic. She even recalled moments of tension, accidents, burns, where her reaction was pure calm. Scientists from University College London, UCL, and Regmore Hospital in Inverness published their findings in 2019. The study revealed Jo had unusually low anxiety levels and a physical recovery rate far above average. Her case opened a new path for research into non-addictive painkillers and treatments for anxiety disorders. But Jo's case also raises philosophical and ethical questions. What does it mean to live without pain? Is pain an evolutionary tool we actually need? Could we eliminate it without consequences? Jo doesn't see her condition as a total advantage. She acknowledges pain serves a purpose. It alerts the body when something's wrong. In her case, she suffered burns without noticing and had fractures only detected through X-rays. Her pain-free life is a mix of freedom and risk. Today, Jo Cameron is known as the woman who doesn't feel pain. But to science, she's much more. She's a window into a future where physical and emotional suffering might be genetically controlled. A future still far off, but now comes one of the most interesting cases in the century. Ashlyn Blocker. She was born in Georgia, United States, in the year 2000. From day one, her parents noticed something strange. She didn't cry. Not at birth, not when she fell, not even when she burned her hands with hot water. Her skin blistered, but she simply smiled. At age 3, an eye infection revealed what no one expected. During the exam, Ashlyn laughed while the doctor pressed on her inflamed cornea. That's when she was diagnosed with an extremely rare condition, CIPA, congenital insensitivity to pain with anhidrosis. This genetic disorder prevents the body from registering physical pain. People with CIPA can feel touch, pressure, and temperature, but not the pain that normally warns the body of injury. They also don't sweat, making them vulnerable to overheating. For the Blocker family, life changed completely. Every day became a battle to protect Ashlyn from herself. She couldn't feel if she broke a bone, burned herself, or had a fever. Once, she leaned against the hot muffler of a pressure washer and peeled the skin off her hands without making a sound. Her parents had to inspect her body constantly for invisible injuries. They taught her to check her skin, to look for signs of damage, and to report anything unusual, even if she didn't feel it. Ashlyn grew up with restrictions. No contact sports, no unsupervised running. At school, her teachers were trained to spot signs of injury. Despite everything, She remained cheerful, curious, and emotionally intelligent. Her case drew the attention of scientists and doctors around the world. Researchers began studying her DNA, searching for clues to understand how pain works. The gene responsible for her condition, NTRK1, encodes nerve growth factor receptors. When mutated, sensory neurons fail to develop properly. But the most surprising part is that studying Ashlyn could help millions. Her genetics may hold the key to developing non-addictive painkillers, treatments for chronic pain, and even therapies for anxiety. Ashlyn doesn't see herself as superhuman. She knows pain serves a vital purpose. Without it, the body is defenseless. She's learned to live cautiously, but also bravely. Today, Ashlyn Blocker is a symbol of resilience and science. Her story not only moves people, it inspires. In a world where pain is part of life, she reminds us that understanding it is the first step to overcoming it.